So today's video is going to talk about hearing loss and its relationship with diabetes. Believe it or not, individuals with diabetes, typically type 2 diabetes, are 2 to 3 times more likely to develop hearing loss. And a lot of people don't know this, but this is so important. So in reality, when you are diagnosed with diabetes, one of the first things that you should do, in addition to getting your eyes checked, your feet checked, getting your prescription medications, getting used to those changes, and maybe some dietary changes, you also have to get your ears checked. And most of you, if you catch it early enough, will not have hearing loss just because of the diabetes. You may, but that's what we need to look at in that diagnostic appointment, as to whether or not the changes to your blood sugar levels have affected your inner ear. And the reasoning behind it is pretty fascinating. So some of the smallest blood vessels and microvascular structures in your entire body are inside of your inner ear. And if any changes to the blood sugar happen, so higher amounts of sugar in the blood make the blood thicker and more dense. So nutrients do not flow as easily throughout that system. And since the inner ear has some of the smallest microvascular structures, it's a real challenge for the proper nutrients to get into the inner ear. And this can cause damage. The research is looking at how temporary or permanent this damage is. There is some evidence to show that if you change your diet, you follow your prescriptions properly, and you do everything that you're supposed to do, that your doctor tells you to do, some of those changes might be reversible if we're able to get those nutrients back in the inner ear. But if this is a chronic condition that's not properly managed, these changes can become permanent. And then we have a snowball effect, with hearing loss affecting how your ear sends information to your brain, how your brain processes sound, and then it just becomes more and more of a challenge as the time goes by. So individuals with diabetes, you're 2 to 3 times more likely. Pre-diabetes, because there is no hard and fast from pre-diabetes to diabetes, and it is more of a gradual change. Individuals with pre-diabetes are a higher likelihood of having some changes to the auditory system as well. Then you also, if you're having changes to the cochlea, which is the hearing organ in the inner ear, you're probably also having changes to the semicircular canals, which is the balance center of the inner ear. And so this is all together, it's all encased in bone inside of your skull behind your eyes. So if you have changes to your hearing portion, there is a higher incidence of falls and vestibular dysfunction. So it's very important for your primary care doctor to refer you for a diagnostic hearing and balance evaluation upon diagnosis of diabetes. If nothing else, if you're not experiencing any challenges from your hearing or balance, that's fantastic, but we'll be able to establish a baseline exam to make sure that you are good to go, and we can, if there are changes, we can monitor those changes, because if anything's affected your eyes, it most certainly has also affected your ears, since the ears have those smaller structures than the eyes. So something to know about, something to share with others, and if you ever find yourself in that situation with the diabetes diagnosis, now you know that not only do you need to handle those other parts of your health, but you also need to look into your ears. Hope this was helpful. Be sure to share. Thank you.